New at noon, retired NFL quarterback Brett Favre revealed his Parkinson's disease diagnosis to the world. It happened as he testified on Capitol Hill about welfare reform. Now, he is the second known athlete that I know personally to battle this disease, and the first everyone knows is Muhammad Ali. We are so delighted to have with us Paige Sanders with Neurology Consultants to be able to tell us a little bit about the disease, and should we be shocked and concerned by what Brett Favre announced?
Well, I did hear about the announcement, and also thank you for having me here today. With head injuries, it is certainly a risk factor with Parkinson's, but it's not something that we typically see at Neurology Consultants. We mainly see idiopathic Parkinson's disease, and that's really where it's a movement disorder. It's progressive, it's chronic, it affects the nerve cells in the brain, where the nerve cells break down and die, and that decreases the dopamine in the brain. So the dopamine is what controls a lot of the movement. So that's where you see the Parkinson's symptoms, which include a resting tremor, or it's called a pill rolling tremor. It's typically in one hand at rest. People will have a shuffling gait where they take smaller steps. It's more difficult to turn, so safety becomes an issue with Parkinson's. They become more stiff. So doing just day-to-day tasks such as getting dressed becomes, more difficult. And unfortunately, this is a chronic condition. It is progressive. There's no cure, unfortunately. The treatments that we use primarily are Sinemet. It's a medication that was FDA approved in the 70s. So there have not really been a lot of changes. We really depend on physical therapy to help with that gait and balance. Also with Parkinson's, the patient can develop a softer voice, more of a monotone. And so we depend on speech therapy also to help with that. They have a great program at Longtown just designed for Parkinson's patients called Big and Loud. And it really helps for that Parkinson's patient to help to, improve their gait, take bigger strides, and also with their speech to strengthen their voice.
Wow, just listening to you discuss that. So this is something that not only affects athletes, but just basically everyday individuals. But for an athlete, do you think there's a higher percentage of them getting Parkinson's because of the amount of hits that they take? Because Brett Favre said that over thousands, he had thousands of hits.
That's what I heard in the interview, but absolutely that's going to increase his risk. But I feel like most of us are not athletes, so it's gonna, for the everyday person, the risk factors are gonna be someone that's over 50. Males predominantly are more at risk than females. And so again, I wish there was a treatment or a cure for this, but unfortunately there's not, so we're left to just symptomatically treat the Parkinson's disease.
All right, well, thank you so much, dear Miss Paige Sanders, for joining us this afternoon.